Peter is from Hudson, Iowa, and attended Iowa State University for his Doctor of Veterinary Medicine degree and Master's in Veterinary Preventative Medicine. He is employed by Innovative Agricultural Solutions, a swine veterinarian practice based in Ames. Peter works with a diverse set of clients throughout the United States, providing veterinary and production management services. In addition, Peter is actively involved in his family's farrow to finish hog farm and row crop operation. Dr. Cezar got his DVM and Master's in Veterinary Science from the Federal University of Pernambuco. After practicing for 2 years as a technical veterinarian service in an autogenous vaccination company, Dr. Cezar joined Iowa State University, where he is pursuing his PhD in population science and animal health. Today, his talk will be using aggregated veterinarian diagnostic data for animal health decisions. Help me welcome Dr. Schneider and Dr. Cezar to the stage.
Good afternoon, everybody. First of all, thanks for the Iowa Swine Day Committee to invite us for this presentation. It's an honor to be here presenting with Dr. Schneider here about using aggregate diagnostic data for animal health decisions. And today, basically, we're going to talk mostly about the SDRS, the Swine Disease Reporting System. That's a project that has a goal of sharing information about endemic pathogens here in the swine industry, mainly in the US, and also share this information with producers and veterinarians to take decisions in the field based on these aggregated data that we have. But let's try to understand what is the swine disease reporting system. The analogy that I make is that imagine that any TV channel about news, like CNN or BBC, that you have like politics, economics, or sports in the news. But imagine if you have that for the swine industry. So a channel that you can just see and look what's going on in terms of pathogen activity in the field. But how that works? So we have 6 veterinary diagnostic labs, most of them swine-centric, that receive diagnostic data from producers and veterinarians. And we aggregate all this data, mainly anonymized data, because we don't know which producer, we don't know which vet submitted, but we know which state it came from. And then most of these data are PCR data and sequencing data. And then after we aggregate all this information, we report back to the industry. But not only aggregate this data, this PCR data, but we also have an advisory group made by veterinarians and producers that they interpret this data. So after we aggregate it and we send these previous reports for them, they make some comments like, oh, this specific uptick that you are having for this pathogen, I'm seeing in the field. Or no, this is just surveillance that we are doing. So they kind of are our eyes in the field to understand what's going on. And then after the comments of the advisory and this compilation, we do all the reports that we compile all this information and put the numbers that we have, so the number of testing that were performed, but also the comments of the advisory in this PDF report that is sent on a monthly basis to the producers and to the veterinarians. So that's how it looks like. This is the PERS virus page, for example. So we have the chart with number of cases, the proportion of the age category that are submitted in the VDLs, also the positivity, and also the most prevalent sequence that we have in terms of lineage and RFLP. But it's not only PERS, as you can see here in the slide, we have 8 endemic pathogens in the report, PCV2, PCV3, influenza, Delta coronavirus, PD, TGE, and Mycoplasma. And also only for an ISU VDL, we have the confirmed tissue diagnosis data. So all the tissue cases that are submitted in the ISU VDL, and the diagnosticians analyze this case, and then they confirm something like, oh, based on this lesion here is Mycoplasma. So we compile this information as well, and we report back in one page in the report that we have. And then the distribution of this report is for free. You can just sign up to receive that, the PDF format. But also you can listen to the podcast format, so you can just listen to the report that we go to the monthly findings. And then we also have a guest that we invite to talk about the specific disease that we are having increased activity. Also, if you prefer to look to the YouTube as well, we have the YouTube format of the report that is kind of the same of the podcast, but with the images. And then that's how the flow looks like. So first, taking the diagnostic data from the VDLs, anonymized data, then compile all of them and put the charts for you guys to take a look in the PDF format, get in the comments of the advisory board, and then report back to the industry. So this is just the PDF that I talk about, but the PDF is not the only tool that we have available. We also have the dashboards online. If you just scan the QR code here, you are going straight to the website of the SDRS. And the dashboard is updated on a daily basis. So every time that we have new data come from these VDLs, we update it and put it in the dashboard. And you can see that all the pathogens are listed there. You can just click it in the specific pathogen, and you will have all the information about it. And then this is the number of cases that are tested, PCR cases. But we also have in the dashboard the state-level monitoring. So for this specific one, is a color base. If you look to the states, you have this dark red color. There are states that have increased number of positive cases for the specific pathogen that you click. In this case here on the screen, you can see PRRS. And also, if you see this blue, the dark blue color, they are having less cases that is expected based on the historical data that they have. So this is another tool that is a good one to take a look and see if your state specifically is having more positive cases. And then we have the benchmark of the PRRS virus sequence. So in this specific case here, you can see which sequence is more predominant here in the US nowadays. In 2024, you can see this red color here, the L1C.5, is a specific lineage of PRRS that cause more aggressive clinical signs in the field. Just for you to take a look how the dashboard works. So you can go, it's in influenza right now, but you can click in mycoplasma, you can click in PD in this case, PRRS, and then after that you can go to each screen, so with specimens to look like which specimen is more predominant submitted, so processing fluids, oral fluids, lungs, or you can move to the map and see which state is submitting more cases for PRRS in this specific period. Or even by age category, you can go back for influenza, for example, and see that win to finish sites are the predominant ones that are submitted for influenza, and South Farm the last one based on our dashboard. So it's really interactive. You can just click and look to the information that you want to look. Also, we have the PRRS Viral Blast tool that's also online and for free. You can just use it. When you submitted any PRRS sample to the VDLs and you ask for a sequencing, you get all these funny letters that I'm going to show you here in the report. So these are the new nucleotides of the sequence. And then you can just copy and paste this result here on the blast tool. So all the letters here that you can have, and click on the button blast, and then automatically in the result, we're going to compare your sequence to all the sequences that we have in these 6 VDLs, and we're going to have the top 10 one that's most similar with your sequence that you just got the result. So with this information, I'm just making bigger here for you to take a look. You can see which sequence of PRRS is more similar to yours. But for you, I would like to address that. Take a look on the similarity level. So we have 2 of them that are 100% similar to the sequence of this client here. But take a look on the date, because, for example, if you submit in this specific date, the sequence that you are seeing must be your sequence. So that's why it's the same. But you can see here that we have 2 dates, so one of them probably is a different sequence. And then you can do some epidemiological investigation to see which states it came from, and then you can kind of figure it out how you get this introduction of this specific virus in your herd. If you didn't understand any of the charts that you look in the SDRS report, we also have an education material in the YouTube that you can go and look to each specific chart that have an explanation of how to interpret the chart and how many different sequences we have, how many different samples. So all of these is education material that is also available for you to understand, to interpret the charts. Right now, after showing the tools, I'm going to the highlights of 2024. So what we are seeing in the field here in the US based on the SDRS data. And I would like to start with the PRRS viral L1C.5 variant. This is the old L1C.144 that we were used to report. Right now in the new classification, we call L1C.5. And that was the scenario in which this sequence hit here in the US, this specific strain. And you can see that most of the cases where 157 sequences were concentrated in Minnesota, only 10 in Iowa, and 1 in Indiana. And by the color base here, you can see which specific site this sequence came from. So if you see the red color, it's from win to finish sites. If you see the blue color, it's from South Farms. And the yellow color is the unknown sample. So if the submitter didn't specify if this came from a win to finish site or from a South Farm. So this was the scenario in 2020. But look the scenario in 2024. So this is a really aggressive strain, and it spread really easily. And that's why right now I have these multiple states here, and look at the numbers of sequence, even Iowa. We are not even in the, we achieved the kind of half of the year, and we have already 805 sequences come from this specific state. And I would like to call the attention here for South Carolina, because this was the first time that this sequence was detected here in South Carolina, which put in risk the North Carolina region that never detected this sequence before, and is one of the largest breeding herd inventories that we have in the US. So with this kind of information, we can make alerts for the industry and like to increase biosecurity, for example, to not make this sequence or this variant spread for more states. But it's not only L1C.5 that we see here in the US. I really like this table here that shows the parvovirus diversity that we have in the US. So if you look overall, since 2021, the L1C.5 RFLP 144 is the most predominant here that we have in the country until 2024. But if you look to a state-specific level, we have different sequences that are the most frequent one that we detected. For example, I would like to highlight here Illinois, that for the first time, the L1C.2, 124 is the most predominant one that is detected in this state. And also it came to Iowa to be the second most predominant one. And we also, we're trying to investigate to see the importance, the clinical importance of this sequence here for the field and see the clinical signs if they are as aggressive as the L1C.5. And the other information that I would like to take from this table is the number of L1A. You can see that it's not the most frequent detected in most of the states, but when you look to the table, you see a lot of yellow colors. So it's still a specific lineage that is around the country and predominant, at least the second or the third most detected in most of the states. And then for PED specifically, I really like this chart here that I would like to make an analogy of a cardiac monitor, but the opposite of a cardiac monitor. If you see a straight line in a cardiac monitor, you are dead, right? But if you see a straight line here, is a good sign because this is the weekly number of positive cases for PED and by state. So we monitor that as well to take a look in which state are having an uptick in terms of positive detection. So in the beginning of 2024, we could get an alert of Kansas, North Carolina, and also Iowa were having an uptick in the number of PED positive cases. And this is important because SDRS was one of the projects that was chosen by the PED Elimination Task Force to keep track of how's the activity of PED over time, so we can take a look if it's possible or not to eliminate this pathogen here in the US. Okay, I just mentioned here a bunch of bad news, right, about the detection scenario in the US, but now we are going to go to the good news about the US in terms of detecting pathogens here. And one of them is the TGE, because since 2021, since March of 2021, we don't have a single positive case for this virus. So either this virus is circulating at a very low prevalence here in the US, or we eliminate this virus without doing any specific task for eliminating it. And this is not a matter of number of testing, because since 2021, over 130,000 cases were submitted in the VDLs, and none of them got positive. And we get an average of 3 PCRs by cases, so imagine this is almost 400,000 PCRs that was tested in the US, and none of them were positive for TGE. Oops. And the second good news for me is the trend of the industry to trying to eliminate mycoplasma here in the US as well. In this chart here, you can see the number of cases that are submitted by month, and when you see the red color is the number of positive cases. But I would like you to take a look in 2023 that we have more number of submissions that occur in this specific year. And then in 2024, we have a slightly decrease, but it's still more than 2022 when you take a look of the number of submissions for mycoplasma. But when we look to the percentage of the specimens that are submitted, most of them, 25% right now, is from deep tracheal swab. That's a good sign that the industry is trying to look at the gills, look at the cells, and see which of them are positive, and go to the elimination process that we always have to take a look in the gills that we are entering the farm to see if they are negative or not to the elimination protocol. And then just to take a look at how this is affecting the percentage of positive submissions, in this chart here, you have the percentage of positive submissions in the y-axis, and the x-axis are the seasons. And you can see the trend here that the mycoplasma had a decrease compared with the last year since 2022, and 2024 right now is even going lower for the specific for the sow farm. It's showing that we might be under the success of going to this elimination process of mycoplasma. So if you got interested in any of the information of the SDRS here, you can just scan the QR code and you can just write your name. It's really simple, your name and your email, and you're going to be like already enrolled to receive the monthly reports for the STRS. And also, if you want to go to our website, you can just scan the QR code here, so all the dashboards are there, all the information all the previous reports as well, that you can listen and have all the information that I just presented here. That was the first part of the presentation. I'm just showing the tools here, but right now Dr. Schneider is going to take my place here to kind of show how to use all these tools in a daily basis in your farm, or if you are a producer here.
Thank you, Guilherme. And again here, if you didn't get this QR code, I would take a picture of it now, so that way you don't have to pay attention to me. You can get signed up while I'm talking. But also, again, I do find that there's a lot of value to this. So if you haven't accessed this or you're not getting it, again, it's a great report to get a hold of. So going forward, I'm just going to talk a little bit about how I use this information in my daily practice world, or even on my own farm at home, and the information that's helpful to me. And again, to start out here, as Guilherme talked about, that monthly report that comes out, again, it's a good synopsis of the information we see, and we got some high-level trends, both long-term and short-term, that we can pick out pretty easily. And you know, so the big thing that I like to see, or I guess talk about when I go talk with producers, is that even though we get to this time of the year when we're in July and August, right, we still have PRRS cases popping up. We still have farms breaking with PRRS. So this doesn't go to zero just because it's warm weather and it's good seasonality for us. We still need to be aware of that. And I think when we get to this time of year, we've got other things we want to do, get out in the boat and go on vacations, whatnot. And sometimes it's easy to let that biosecurity lapse. So we've got to continue talking about this. And this is just a good reminder that yes, we do still have cases that we have to be worried about. The other part I like to point out here to producers that I talk with is, again, beware of the springtime, okay? So we go through this nice summer weather, we have some lower case levels, or it feels like there's lower case levels, and we always kind of get geared up and anxious for that fall time, you know, that October, November, December period where we start to see those rise in cases, and we really start to get shocked again about our poor biosecurity and the amount of spurs that can circulate around. And I don't know if we get into that early spring and things start to kind of feel better. We've gone through our breaks, or maybe there's just a little bit of fatigue from having our biosecurity levels so high that we keep thinking about. But we see as we get here to springtime, we start to see a rise again in some of those cases. So again, we can't take the foot off the gas. So for me, at least, this is just a great report that I like to share with producers to say, hey, listen, biosecurity is a 365-day-a-year thing. We've got to think about it every time we go into the barn and we're working with our pigs. The other thing I'd like to point out, and Guilherme mentioned it, is that yellow area up here as we look at our data. And again, that's our unknown factor, right? It would be really great if we could all work on continuing to make sure we identify where these samples are coming from so we can get more complete data sets. And this, again, continues to help us identify where our PRRS risks are at and look at the data in a more complete way. So again, a great high-level rundown. If you've only got 5 minutes a month to look at biosecurity or look at disease, this is just a great way to get it in your inbox. And again, a good opportunity to talk about biosecurity with the people on your farm, or again with producers as a veterinarian. If we do want some more information, we've got the disease dashboards that Guilherme pointed out that we can go then look at. And I do like to go and take a look at those as well. And again, it just gives us an idea on some of our disease prevalence again over time and what we're looking at. This one for me is a bit depressing, and I apologize. I'd cut off the time frame here at 2022. Actually, 2023 and 2024 look a bit better. But in any case, I think the thing to point out here is again, our red bars are our positive cases, our blue bars are our negative cases. But this black line here, we see the trend, right, of prevalence, percent positives. And unfortunately, we had an upward trend going on with that prevalence of PRRS. So that can be pretty depressing when you look at that and say, man, we're trying to do a lot of things for controlling biosecurity and controlling PRRS, but that doesn't always seem like it's effective. Now, again, we'll talk a little bit more about this, and I think I can argue a little bit, well, hey, maybe actually it's because we're doing a better job of finding PRRS, okay? And so as Guilherme pointed out earlier here, this is the different specimen types that are being submitted. Again, back here in 2013, we started to see oral fluids, again, popping up, probably started even before that, 2010, 2011, when maybe we're starting to really implement those things more. But when I got out of practice, the standard for identifying where our sow farms were status-wise Were those 30 blood samples a month for 4 months, or maybe it was 60, and that's how we decided whether our farms were negative or not, right? So come 2018, and some of the great work that Dr. Lernier's group and others at Iowa State were working on, and others in the industry, but we found that processing fluids are a really good way for us to do some easy monitoring at farms, and where we were kind of, again, trying to pick out those pigs that seemed like maybe they were going to be the PRRS positive ones and take the blood on it. With here, we're able to get sampling across to every pig in the farm, and or at least a broader swath of that. So we're really finding that needle in the haystack at this point in time. So before, when we thought those farms were negative, and I'm sitting on the wean to finish end and saying, man, you're telling me it's negative at the sow farm, but my nursery groups are still going through some PRRS. This is kind of the proof in the pudding that, yeah, in fact, maybe we were missing some of that. So we really implemented those processing fluids more aggressively, cut down on our serum sampling, and you can see the reduction in the number of serum samples submitted. And then again, the other thing is the family oral fluid samplings that goes in this oral fluids as well, that just really allow us to do much better surveillance. We're much more sensitive in our methods. And the great part about those things is anybody can do them, right? We always try to say, hey, who's that one person in the sow farm that can bleed piglets? You know, if we can't get there to do it, or the veterinarian has to be there to do it. With processing fluids and family oral fluids, anybody can do those things. So that gives us a lot better opportunity to get good samples submitted more routinely and get better diagnostics taken, which probably leads to that higher sensitivity, more PRRS positive results, but much better information and knowledge about where we're really at with our overall sow farm stability, as well as, again, wean to finish samples too with the oral fluids is a great way to take a look too. Again, as we look at the overall prevalence, again, blood serum samples dropped from 55% of the overall samples submitted for PRRS in 2013 to 18% in 2014. So again, we're moving to more sensitive types, processing fluids and oral fluids bumping up from 30% in 2013 to 51% in 2024. Our tongue tips next, so that's another great sample that we're starting to do more in sow farms. Again, very easy, cut off the tongue tips on dead piglets, send those in. Again, a very aggregate sample that we can get some good diagnostics from, and again, they're pretty sensitive. That was back here at the top. You're just starting to see those pop up, and you really can't even make it out unless you've got microscopic eyes here. But it's up here at the top in a little orange bar. But again, I expect that maybe that's going to take on a little bit bigger share of our overall specimens submitted as well. The other thing I didn't point out is I had zoomed into just our Iowa results here. So again, that's the nice part about these disease dashboards is if you want to just look at Minnesota, or you want to look at Iowa, or you want to look at Missouri or Kansas or Oklahoma or wherever in the world you are at, what's happening in my state, you can do that on this dashboard. So that's a really nice tool to be able to kind of get that more ground level information for wherever it is you want to look at. On our PED side of stuff here in Iowa, again, we continue to see increased number of samples submitted. But the nice thing is we're seeing a nice downward trend here in our overall prevalence of positivity. Now, it's not zero, okay, so nothing to get up and start whooping and hollering about. But I think it just tells us that, hey, we're implementing a lot of strategies to help reduce that circulation of PED and the other enteric diseases, and they're effective. They're working. And again, if we keep adopting these and we keep getting more folks to be implementing those, we'll continue to see that level go down, and I think that's just a good sign for us. So it's great to take this information back, talk about it with everybody that we're working with and saying, hey, those things that you put in place are making a difference. And we can see that with our own internal diagnostics, but certainly, again, as an industry, we're making good strides. So we can learn from others, too. What are others doing that are being highly effective? And this just shows that we've got some good methods out there we can implement. I also go ahead and take a look at the PRRS dashboard. As Guilherme showed here, we've got a dashboard that shows the changes in RFLPs over time. Again, right here in 2014, 2015, we started to see the rise in the 174s. As we got down here, we started to see the rise in the 144s, okay? So for me, as a practitioner, I'm looking at this and saying, hey, what are our trends? What's starting to pop up? Because again, if I would have had this tool back in 2014, then I would have sat there and said, wow, that's really starting to blow up. What is that? I probably need to start to be aware of that. So if nothing else, it just sparks, if I haven't seen it yet, it sparks my conversations with other folks. What are you seeing with this 144 RFLP? How is this acting? And again, maybe I get proactive with trying to get some more information about that. Similarly here, our lineage classification. Now, I think, again, lineage gives us a great way to talk about PRRS. And as an example here, our 184s, I believe, is this light blue one here. And again, that's again a fairly common RFLP. But if you broke this down, and I wish I would have put that slide on here, you see that 184 is starting to shift from a traditional L1H to an L1D. And again, it's a different virus, and so again, the RFLP does not really give us a great classification as to a common virus over the time, over the industry. We've got a lot of variation in 144s as well at times if we take a look at that historically. So again, I think the lineage maybe gives us a little bit more information along that lines and something better, more specific to talk about, even though again, it's not maybe common for us yet. Hopefully we kind of shift that way. But again, we've got our 174 down here as an L1A, the L1C5, and then, as you go up, like I said, we talked about the L1H, L1Ds. And then here, this one right here, right? What's this one? Well, this is the 124 virus, right? The RFLP, and we're starting to see this, I think it's a 1C2 becoming more prevalent. So is this the next one on the horizon we've got to be start to concerned with, right? I don't know. But again, it gives us an idea to have some conversations about what we're seeing, what's happening with that, and again, maybe be proactive in doing something to find that and get availability for that virus if we want to do something about it. So for me, again, it's great just to start those conversations, okay? And early on in the phase, it gives me an idea what the trend is looking like. Okay, what am I going to do about this, or what are others doing about it, and is it successful or not successful? Continue to talk about how we manage these viruses. Another thing is if some of us are using some autogenous vaccines, occasionally we don't do a great job with updating these, and we may be looking at strains that say, hey, that's kind of outdated, right? That's not something we're seeing a lot of anymore. Maybe we need to look at changing something out on that one, and so we can go ahead and go to the RFLP and the lineage pages and start to say, what maybe makes sense to replace some of those with, and what should we be looking for. And to do that, maybe what we need to do is start using the information that we can gather off the report here from the monthly SDRS report to look at what's our seasonality on PRRS, right? And again, we probably all know about this, but we can see the lines here, the red representing wean to finish cases and the blue representing sow farms. Well, as we take a look at it here in September, we start to see an uptick in those PRRS diagnostic, or the PRRS prevalence in our wean to finish cases that are being submitted. 2 months later, we start to see the sow farms really rising up, right? So maybe what we need to do is be more proactive with doing some of our wean to finish sampling. Hey, what's floating around in our wean to finish systems? What do we have going on? Maybe we need to start doing some more sequencing and virus isolation from those cases so we can get some of that stuff on hand if we're going to be making autogenous vaccines, get those to the lab and make them available, okay? And shortcut some of our steps and time frame to get those vaccines maybe that can be effective for us or helpful for us in managing our PRRS viruses on farm. So again, without having this report, it's maybe harder to see those trends. It's harder to understand some of that seasonality or the precluding events to when it's going to start to hit our sow farms. And so this gives us some better information along those lines. So again, can we jumpstart that autogenous vaccine development a little bit there, and gives us an idea what to expect. The last thing I'll talk about here was the SDRS BLAST tool, and actually, by working on this presentation, I did learn something along these lines. I have always used the ISU PRRS BLAST, which is available on the Iowa State Veterinary Diagnostic Laboratory page. What I didn't understand was that was only sampling from diagnostic cases from Iowa State. The PRRS BLAST tool from SDRS is again using the 6 diagnostic laboratories that are contributing information to go ahead and compare sequences across all those diagnostic laboratories. So again, I'm getting a broader sample size to be able to go ahead and do a comparison against. Maybe it gives me further information regarding regionality or non-regionality to a virus, as well as again, maybe others that I wouldn't have encountered with the Iowa State only page, I now see with the SDRS PRRS BLAST page. So again, it's as simple as throwing your sequence in there. I literally just copy and paste that off the report, dump it in here, give it a title, and I get my results back. So again, the top case, as Guilherme pointed out, this is a 100% match, and this is the same case, so it's just comparing against itself. And then as we go down, hey, look, and this is kind of interesting, right? I have a case that I found in 2024, but I've got no other cases in 2024, right? The most recent one is March of 2023, so that's really odd. But again, it's something to work on, right? Okay, how the heck did this show up? And it allows me to kind of do a little bit of further investigation there as to maybe what went on. So after every time we have a PRRS break, we're always asking the question, where did this virus come from, right? That's what we really want to know, because we want to prevent it from happening again in the future. Can't stop it from being in there now, it's already there, but we can prevent it from coming in maybe at another time. So I think the PRRS tool enables us to kind of understand a little bit of that, right? In this particular case, I've got a bunch of stuff from Iowa. That's not really necessarily going to be extremely helpful because there's just a lot of pigs in Iowa. But if I'm in another state, or if I'm in Iowa, now it starts to compare against something that's coming from Minnesota, or it's coming from Missouri or something else, and I really don't have much history of that around where I'm at, well, hey, that's something to work on too. That's another clue about maybe what my risk factor is, right? Was it a truck that brought it in from there? Was it a neighbor's pigs in the area that I can have communication with and just understand what's going on? It gives me some idea about what risk factors I need to identify. The nice thing about it, again, is this fully respects your confidentiality, right? There's nothing I can really tell. I suppose if you're in Vermont and you had a PRRS sequence and you threw it in and you're one of 2 sow farms in Vermont, well, heck, you might be able to figure it out, right? But for the most part, what we're talking about in the world with Iowa, Minnesota, et cetera, it's not going to give away any clues that says, hey, listen, this person was the person that gave you the virus, right? And again, it gives me some ideas. Is regional? Did it come from elsewhere? If I have a break in Colorado and it's an Iowa sequence, well, hey, that's interesting. We can do something with that. The other thing that's been able to we've been able to do with this is we've been able to have communication with other veterinarians. So working through the diagnostic lab, working through others, being able to make a connection with somebody else. Hey, this was a really close match into the PRRS blast of what I have. Would you mind asking them if they would talk with me about what they're seeing with this virus, how this virus is acting on their farm, what they found as their risk factors, et cetera. And I've been able to have a number of these conversations through that have been extremely helpful. And again, whether it's preparing for what to expect or again looking at risk factors, we've really been able to make some headway in terms of addressing some of those things. So again, I find a lot of value in that PRRS blast tool. So if nothing else, this is another thing to go take a look at the SDRS page. With that, I just want to say thank you. Again, I guess at this point in time, we'll open it up to any questions that you guys may have. These are my children helping me with a necropsy. So we start them young in the Schneider household. Does anybody want me to go back to the QR code? I'm going to, because again, this is probably the most important thing you're going to get out of the presentation today, is this QR code. It's easy access to go ahead and get that report if you're not already signed up. But again, certainly just a nice 5-minute summary once a month as to what's going on.
Question, going back to the difference of seasonality over the last couple of years with some of those breaks in later spring, early summer, that if you look historically at the data, weren't quite as evident, but have become more characteristic the last few years. Anything within the data, Guilherme, to help illustrate or give any indications to why that pattern may have been arising over the past 2 years?
For each specific pathogen, Dr. Gebhardt?
PRRS.
For PRRS?
Yeah.
Yeah, for, I think it was 2023 and 2022 as well, we had some longer breaks, right? I think Dr. Yaski mentioned as well that they closed the herd for a longer time, and then we were like pushing a little bit more, and then the seasonality kind of break a little bit, so we had that for this pattern. So I don't know specifically what happened for that, but maybe more aggressive strains, and that's why it's kind of having this longer period of detection that we are having the last years, and sometimes like push to the summer, right? So we have some specific years that we were not expecting all this positivity in the summer, but we got because of these aggressive strains probably.
Any more questions for the speakers? I have one question. Are there any emerging trends or technologies that further the use of these aggregations data?
For one trend that we are seeing specifically right now, that it was the one that I presented for the mycoplasma, that it was not something that we used to see a lot, like it's a lot. There's number of testing increasing and this decreasing positivity that we had. And also another trend that we just picked up because we had this pathogen was PCV3, that is a pathogen that was not like monitoring so far here in the US. And when we start to aggregate it, it was the only pathogen that we see that the detection in sow farm is always above of the wing to finish sites. So usually it's the opposite. We have higher positivity in the wing to finish sites for all the other pathogens. But for PCV3, since 2018, the sow farms, the positive cases are always above the wing to finish sites. So it's something that we don't know why, but it's a trend that we are seeing right now, and good to take a look to see what's making PCV3 be this pathogen so prevalent in sow farms.
Any other questions? Okay, if not, let's thank our speakers once more.
Appreciate it.